APOSI peeps! Welcome back to our Wednesday Wellness webinar. Our topic for today is one of the DOH mandated topic. Be open because we will be using some medical terms so that we have to substitute to a specific word, but you can ask a question after the presentation. So with that, we invited a speaker to share some information, and it is my privilege to introduce our guest. She is my classmate during during my college days with Nurse Lidine, and right now she's practicing her profession for 6 years and counting at Surala Community Hospital, which is located in Mindanao. So currently, she is an operating room and delivery room in charge, and at the same time, she's taking up master's degree in nursing. So let's welcome Miss Tessa Mel Moralidad, RN. Hi, Tessa.
Hello, good morning. Good morning,
There.
everyone. My topic for today is immunodeficiency virus. HIV po. Very familiar tayo niyan. Sino ba yung kilala natin na may HIV sa Pilipinas? Si Miss Sarah Jane Salazar, may his soul rest in peace. Namatay na ho siya way back 2000. It's like younger, 20, 23, 24, if I'm not mistaken. But in other countries, in Western side, meron po tayong Magic Johnson and then Freddie Mercury. Sino ho dito nakakilala kay Freddie Mercury? Well, these people, these celebrities, make it publicized because they want to raise awareness of what HIV is. Kasi ang sa atin, mostly dito sa Pilipinas, ang stigma is pag may HIV ka, nakakadiri ka. Which is I think it's really unfair. I mean, yeah, they have the virus, but I don't think we need to parang ilugmok mo pa sila na wag mo sila parang kailangan mo pa silang putyain. Which is in our graduate school, we are taught on counseling. And this one is included also na they need also a support. No? They need also a pangunawa. Regardless of what they did in the past, but also we need to help them. That is why in testing HIV, this is very confidential. Hindi dinedivulge yung kung sino man siya. If he's positive, if he or she is positive. Kasi ayun, ganun talaga ang tao. We're not all, but some of people are very judgmental. Pasensya ho sa, that's reality. Okay? But then again, it's better na napag-uusapan siya ngayon. HIV ho is nakamamatay. Pero, nakamamatay pag pinabayaan. Pero you can live longer if you want to be treated right away. May paraan naman po eh. You can have it, HIV is for life, but you can control the condition. You can control the virus, you can control the viral life cycle of the virus kasi yun naman ang ginagawa talaga ng gamot. It's successfully interrupting the cycle of the virus. So with that, ang HIV, pag sinabi kasing HIV, AIDS agad. Well, these are the common confusions of people. HIV, AIDS agad yan. No, they go hand in hand. Totoo po yan. But before leading to AIDS, HIV muna tayo. So, kumbaga pa, critical condition na ho yung AIDS. It will be in stage 3 if left untreated. Kasi may stages ho ang HIV. So, we will go on through that with this discussion. And HIV is a virus that attacks body immune system. So, it will make your immune system, it will cause immune system deterioration. In the system of our body, immune system talaga yung sa kanya. Kasi tayo, we have these cells in our body. We have this white blood cells that fight against infections. They play an important role in our immune system. One of these are your CD4, your or helper T cell, or then your dendrites, the macrophages. So it's very deep na, di ba? But then those are the cells that fight or it plays an important role in our immune system. So bakit immune system? Kasi nga from the word HIV, di ba? gagawin niya yung pasyente na immunodeficient. So pag immunodeficient yung patient, mas madali kang mahahawaan, mas madali kang magkakasakit. And then your recovery is very parang mahina yung recovery mo kasi once these cells are not in normal count or normal range, bababa talaga yung immunity. In COVID ngayon, it's really important to boost our immune system. Kasi lahat naman ng sakit, tatargetin talaga. Kasi ang ating kasing katawan po is, pag meron tayong infection, o may infection na papasok sa atin, we have this response. So those cells are responsible in fighting those infections. So kapag yung mga cells na yan ay hindi na nagpa-function, it's not working the way they should be, ang mangyayari po sa atin, tayo ho ay magkakasakit. And with HIV, ang target niya talaga immune system. Now, in HIV po, wala po siyang effective cure. Once you have HIV, you have it for life. But also, with proper medical care, makontrol mo naman siya. But then, you have to take your medications so that it will not lead to stage 3, stage 2. Kung pwede nga lang sa stage 1 pa lang, ma-detect mo na. But then, later, you will understand kung saan ba dapat tayo maging aware. So, ganyan. So, HIV treatment, ang HIV treatment po kasi, what do they do is that, and what I have said earlier, ang ginagawa nila is they interrupt successfully the viral cycle life of those virus sa katawan mo, sa dugo, present sa dugo. So, in taking those medications religiously, you can live longer, you can have healthy lives, and you can protect your partners also. So, it's not just about you, it's about the people around you also. That's why you are doing this. And also, with that, yung mga nagtitake po ng mga HIV medications, they need also the support of their family. Most importantly, kahit ano hong sakit yan, they need the support from family group members. They need pang-unawa more than anything. So where did it come from? Bakit ba? Saan ba nanggaling yung HIV na yan? So there was a study na it came from a chimpanzee in Africa. So there are men who are hunting for meat. The bad news is, yung meat na yon may infected blood. So on and so forth, nag-jump na into humans, and then the rest was history na. Over decades, nag-spread na siya from Africa, from one continent to another. So yun na ho yung transmission niya. Pero before, when I was in college, all came from an animal. Hindi siya galing sa tao. So what are the symptoms of this HIV? Common. Kaya nga, minsan, I also understand na parang kasi sa very common, ang iba naman, lalagnatin ka talaga. Diba? If you have infection, you have fever, mag-chills ka, yung iba nagkaka-rashes, nagkakaroon ng hypersensitivity, may allergic reaction, may night sweats, may muscle aches, and then may sore throat, may fatigue, swollen lymph nodes, and mouth ulcer. So these signs, these symptoms are very common. And when we have flu in our body, this is a normal response. Actually, itong mga symptoms na ito, these are the normal response of your body pag merong infection sa katawan. So parang ikaw, mag-iisip ka ba na may HIV ba ako? Parang ganun ba isipin mo? Diba? Hindi ba pwedeng meron akong ubo, sipon, diba? Kasi pwede siyang accompanied with other symptoms. So, hindi mo siya agad-agad ma-distinguish na, HIV to. Kasi ang daming sakit. Ang dami-daming sakit ng tao na symptoms ay ganito. Even in COVID, there's sore throat. There are fatigue. Diba? Wala lang ang mouth ulcers. Also, you have fever. Wala nga lang diarrhea. Wala nga lang abdominal pain. But then, mostly is very common sa other sakit. So parang, para sa atin, parang, common lang naman to. Kung alam mo kasi yung activity mo minsan, you will be aware. Pero pag, alam mo yun, pag ito na mga sakit na to, since bata ka, meron namang ganito. To have this awareness, especially yung mga activities na ginagawa natin, whether it be physical, sexual, we need to be aware of our actions. Kasi going through, magkakaroon talaga ng consequences. And then also, pag natsambahan ka na you have exposed to a person who's infected of HIV, yun na yun. That's it na. So, what are the stages? These are what I mentioned earlier. Stages of HIV. Meron pa po siyang stages bago po tayo pupunta sa AIDS. Okay? So, the first stage is the acute HIV infection, which is the stage 1. So, in stage 1, meron ka na nitong, some people may have this flu-like symptoms. So, like what I've said, that's the body's natural response to infection. So, hindi ka magkakasakit agad-agad niyan. Pero you have the large amount of HIV in the blood na. It's going na. Parang yun yung sinasabi ko kanina na hindi naman kasi sa atin very common. In medical field, we are always being given update ng DOH, especially in the hospitals, na about HIV. Kasi meron naman tayong HIV Awareness Month. So we are updated. Wherein yung ibang tao, mostly yung mga citizens na hindi, they just find na pag nag-HIV, pag nalalaman nila na may HIV sila, very terminal na. Nasa stage 3 na AIDS na siya talaga. So very, very low na talaga ang ating immune system pag ganyan. So yun yung yun yung kulang, I think, na dapat talaga ginagawa na make the people aware nowadays na hindi na humatanda yung na-infect ng HIV. Mostly mga bata na ho, because they are now sexually active. We have a patient before na male, actually, he's a gay and he's very young. History taking, syempre hindi naman sasabihin na may HIV. Hindi mo naman agad sasabihin na AIDS or HIV yung patient. Even the doctor will not do that. But going through the assessment and everything, pumunta talaga yung public health sa amin. Which is, meron kasi, di ba, meron tayong treatment, testing facility for that. So meron pumunta sa amin, and then they keep the result confidential. Ang nakakaalam lang pamilya. So, pero we have this idea na. That is why every now and then, if we are going to the patient to make some intervention, naka-full gear kami. Talagang naka-double gloving kami, kami. And then, yung nanay, very denial. And then, kinausap siya ng doctor namin. Namatay siya, pneumonia. It's severe, high-risk pneumonia na siya. Kasi with this kind of sakit, ang kakamamatayan mo hindi naman itong sakit na to, the HIV or the AIDS. It's not. It's the opportunistic infection that will be in your body na. Kasi 'di ba, immunodeficient ka na. So ang mangyayari, mas madali kang kakapitan ng sakit. And then ang progress pa ng sakit mas madali kasi wala ka ng wala na yung mga cells mo na supposedly mag-fight against the infection, wala na. So they are very low na in count na hindi na nila makaya yan. So namatay siya, pneumonia, high risk pneumonia. And then if you can see his x-ray, puro na white. Ganun ho siya. And then he's very young. He's a call center agent in Davao. So may promise pa yung bata, matalino. Gaya lang, nung kinausap na siya ng doctor, doon na siya nagsabi na, yes, I'm sexually active. So that is why what I am trying to kung sino po ang mga magulang dito na we need talaga to guide our children, lalong-lalo na ngayon na this is very, it's not it's not a new issue. It's just that people lang hindi lang nila parang inaano pa nila, ngayon nga ang COVID nga ngayon lang dumating, pero ang tao panic na. Pag umubo ka lang, parang sasabihin ng iba, COVID ka na. But this one, HIV, it's very important also na makakahawa ka. It's not just about yourself. It's other people. Pag na-expose sila sa'yo. So, with parents, it's really important now to educate our children properly about sex education. That is very important. Kasi ngayon po ang mga kabataan, marami na pong alam. So, kailangan ho natin silang gabayan to the point na naiintindihan nila yung gagawin nila, and also to let them realize also the effect and the consequences kung gagawin man nila yan. So, with this, in stage 1 ho kasi, you can seek medical care kung ikaw ay very aware ka naman sa ginagawa mo. Just medical health, and then there are these testings that you can do. Meron tayong antigen antibody test. So ito, may mga window period ito. Presence ng antibody sa katawan and the antigen before ang presence na yon ng HIV. Also, may nucleic acid test or not tayo. Can diagnose acute infection. Ito mabilis to, but it's not routinely done here in the Philippines. Why? Because first, hindi siya mahal. Mahal to eh. Mahal tong nuts. And then also, ang ginagawa lang ito ng mga doctor if they are sure na you're highly exposed to a person with HIV. So, ganyan. So, ang most na ginagamit is the antigen antibody and the antibody test. May presence. But if kung sa NAT kasi nucleic acid test, it's very kasi madali lang to, ilang days lang to siya ang window period. But then ito it's even if naka-test ka, for example, if you are negative kahit sa window period na yon, it's best na if you know you have may mga activity ka talaga na very active, it's best na after the window period, kahit nag-negative ka, you need to take the test again to just be sure. Just be sure na parang negative ka talaga. Kasi although nag-negative ka the first window period, but it's best na you take the test again after nung negative mo and then after ng window period para ma-sure talaga na negative ho kayo. Negative tayo sa ganito. After the stage 1, we have the stage 2. So this is the chronic HIV infection. So in this stage, magtatanong kayo, ma'am, bakit asymptomatic? Nung sa stage 1, may flu na. Well, again, kasi 'di ba in stage 1 naman, hindi naman lahat. There is flu, pero hindi lahat. Hindi naman lahat nagkakasakit. So with that, 'di ba, ang viral load is progress na, dumadami na. And so, mas lalo na sa stage 2. So these are the asymptomatic HIV infection, hindi mo na nalaman kasi like cancer, 'di ba? Paano ba natin malalaman na tayo ay may cancer pag terminal stage na? This goes to this also. Or clinical latency. So active siya, nagpo-produce at very low level na siya. People may not have any symptoms or get sick during this phase. Unlike sa stage 1, no, merong flu-like. Pero hindi lahat. It's just that in the study, parang mas naano nila na mas present ang acute infection sa stage 1 kaysa sa stage 2. Dito, without taking HIV medicine, the period may last a decade or longer. Depende ho ito may last decade or longer, depends ho sa immune system ng tao. Because if not, tulad na sa case namin sa hospital, nung bata, she's like what, 19? Sa 19 na yun na edad niya, 19 siya namatay. So meaning, ang progress ng kanyang sakit, mabilis. So, it may not take a decade or longer. Lalo na pag ang katawan mo talaga ay bibigay at bibigay na. So people can transmit HIV in this phase. Makaka-transmit ho talaga siya. Even in stage 1, nakaka-transmit na siya. Kaya nga ho tayo magpapatest. The amount of HIV blood is called the viral load. Yung minention ko kanina, yung viral load, 'di ba? Kasi meron tayong mga antiretroviral treatment. Ito 'yon, sa HIV 'yon. Ang kanilang function is they successfully interrupt the viral cycle of the virus. So ito ho kasi yung tinatawag nilang viral load. So, ang the CD4 which I mentioned earlier, di ba, ang sabi ko sa inyo, yan yung count na chine-check talaga if there is a presence of HIV sa katawan ng tao. So, pag ang CD4 na yan, pag ang CD4 mataas, it's a good prognosis. Ang CD4 ho, pag mataas ho, meaning okay po ang immune system natin. But if the cell count goes down, ay yan na ho talaga. It's in the stage 2 ka na talaga. Pababa na ng pababa ang iyong CD4, that will lead na to stage 3. So may mga may mga level increase na siya. So dito na ho na lumalabas yung mga symptoms kasi papunta ka na ho sa stage 3 at mababa na po ang CD4 count natin. So in stage 3, yun na ho ang AIDS. So bago po tayo mag-AIDS, meron ho muna tayong HIV stage 1, stage 2, and stage 3, which is this one, ito na ho yung terminal. Kumbaga pa ho, sa ibang sakit is terminal stage. So, dito na ho kasi left untreated na, hindi ka na nagpapacheck. So, ang nangyayari ho sa ating immune system is very, nagde-deteriorate na talaga siya. So, yung sinasabi ko kanina na hindi ka mamamatay sa AIDS, pero mamamatay ka sa opportunistic infection like tuberculosis and pneumonia. That is very common. Respiratory. Tatamaan yung respiratory system mo. 'Di ba? So, pag ganon, medication ka ng medication, pero hindi na kinakaya ng katawan mo. So, yung sa case ng aming patient, talagang hindi niya na kinakaya. Even the mouth ulcer, it's very severe na. Makikita mo sa kanya yung mouth ulcers niya, severe na. Hindi niya na nga ma-open yung mouth niya. Ang daming lesions talaga. It's not a joke. Kasi 'di ba when we are studying, iba kasing nag-aaral ka lang sa nakikita mo yung pasyente. When we are taking care of that patient, ang sabi ko talaga, my God, totoo talaga siya pala. Hindi lang siya yung sinasabi na meron dito, yung si Sarah Jane Salazar yung namatay na meron dito. Meron talaga siya. Kung tutuusin, bata pa, 19 years old. Sabi ko, 19 years old, ikaka-graduate lang nito. Teacher pa naman siya. So parang ang sayang, 'di ba? Ang sayang. And then he also admit na he's sexually active. So sa ganung paraan, although the mother denial pa rin ang nanay, pero syempre karapatan naman yung nanay kasi ikaw ba naman. With that, mga ilang weeks ba siya sa amin? I can remember, naka 2 weeks ata siya sa amin. Pero maawa ka sa condition niya. It's, pag severe na talaga siya. Pneumonia yung kinamatay niya. So very common ang tuberculosis and pneumonia sa kanila. And ang payat-payat nila. Sobrang payat. Totoo ho yan. It's not a joke. It really happens. And then, marami na silang, mataas na ho ang viral load sa katawan nila. So, what do you expect? Diba? Wala ka ng, yung immune system mo wala na. Pero ang virus, pataas ng pataas ng pataas. Ang cycle nila, dumadami. So, anong mangyayari sa katawan? Very important po ang ating immune system. So, even if i-treatment mo siya, very too late na siya. So, it's very important po kasi na in HIV, yung early detection. Kasi, di ba, once you have HIV, it's for life. Okay yon, given na yon. But you can control it. And you can live longer. Ang daming HIV positive dyan na can live longer. Even the artists, although hindi lang nila nagpa-publicize, pero ang dami dyan. Even, I saw Isa Calzado's interview. Diba? He's an advocate of HIV awareness. Sabi niya, may mga kaibigan siya. But then they are doing fine because they're taking the medication. They are taking the antiretroviral treatment kasi meron tayong mga pre-prophylaxis exposure, post-prophylaxis exposure. Yan ho is kung alam kung tayo po ay aware sa ating mga pinagagagawa. And kailangan lang po talaga natin ng, siguro, it's a form also of discipline. I mean, sometimes we tend to forget na may mga sakit na nag-exist na ganito, and sabihin natin, wala yan, hindi yan totoo. But everyone is true. And as much as possible, we need to take care of ourselves, because taking care of ourselves is also taking care of other people, especially our family. Okay? Kasi mahahawa, mahahawa, mahahawa mo sila. So, how can we have HIV transmission? Yung ibang tao, meron akong, you can get HIV from kissing. Sabi ko, hindi ho. From laway, it's not. In TB and tuberculosis, before ka ma-infect ng TB, ng may tao may TB, parang sabi ng doctor namin, parang you need to have this isang pail ng laway niya bago ka magka-TB. Parang ganon. So in HIV, parang siguro correlate na rin doon. So HIV transmission can be anal or vaginal sex. So unprotected sexual intercourse with an infected partner, or even yung mga multiple partners. This is very common, multiple partners. So that is why po it is very important na maging stick to one tayo. Tama ba yung term? I think it helped a lot. Oo. And also vertical transmission from a mother to the baby. So in utero, during delivery, and breast milk. Remember nyo yung sa movie ni Sarah Jane Salazar? Hindi niya pa alam no na may HIV siya. I saw that movie. Ang bata, hindi alam ng mga nagbabantay. Kasi hindi pa naman alam ni Sarah Jane na ano siya nun eh. May HIV siya. So after she gave birth, yung bata, nagtataka sila. Bakit balik ng balik sa ospital? Nagkakasakit na nagkakasakit. Then doon, nalaman na positive siya. So, yun, di ba? Yun ang kanyang effect. Nagiging immuno-ano ang bata. Buti na lang na-treat nila ng maaga. So, mother to baby during pregnancy, birth, or breastfeeding, and also sa amin, sa hospital, it's very common. And even kayo ho, sa labas, yung mga nag-inject dyan, mga gluta-gluta po dyan, be very, take precaution po. Sharing of needles, syringes, or other drug injection equipment. Kami sa hospital, we have this needle prick. Kunyari, pag na-prick kami ng mga patient, na-prick namin yung aming fingers ng kunyari mga injectables ng patient, we note that. And also, we take test para just to be sure. So, meron kaming needle prick na protocol sa hospital. It's for the safety of everybody. Kasi hindi namin maiiwasan minsan, lalo na pag in case of emergency, ma-prick mo ang sarili mo, ina-inject mo na sa patient. Although we use gloves, but then, kahit naman may protection naman, kahit may gloves ka, but then you need to check talaga. Kasi you'll never know, hindi mo naman alam ang mga ano ng patient mo dyan. So you can transmit, mga body fluids, it is very important, makatransmit ng HIV, your blood, your semen, your vaginal fluids, your rectal fluids, pre-seminal fluid, breast milk. Pwera lang saliva. Okay, but those fluids, kasi, kunyari, if you have this lesions, kunyari, you have sex and may lesions ka sa vagina mo or anything and you have seminal fluids, siyempre, may portal of entry na sila. Sa katawan mo. Unlike yung mga kissing, yung mga hugging, wala naman yun. Ang ibang tao kasi, pag kunyari may HIV, kaya huwag kong lumapit dyan. Makakahawa yan. Kahit mo hinawakan mo lang, nahahawa. Hindi ho. That is too much naman para i-act natin sa mga taong with HIV na nag-publicize. It's not. Meron naman hong ways not to transmit HIV. So, ano ba yung mga ways na hindi natatransmit ang HIV? Diba? Mosquitoes, ticks, or other insects. Hindi naman. Saliva, tears, or sweat. Hindi naman ho yan nakakahawa. Hugging, shaking hands, yung iba ayaw na makipagtamay. At sasabihin na, ay naku, mahahawa ka niyan. Sharing toilets, sharing dishes, hindi ho. Social kissing, hindi rin ho. With someone has HIV, through the air, hindi ho siya airborne. HIV, hindi ho siya airborne, di ba? It's fluids ho siya. Blood. So, dapat may portal of entry siya sa katawan mo. So, these are the very common HIV prevention. Okay. I remember the DOH on 2019 mandated, they will give free condoms and lubricants para to add to for HIV prevention. So use condoms the right way every time you have sex. So there are people who use condoms, there are people who are not. Kaya nga ko in schools, ano ba yan, ano ba yung term? I forgot the term. Sa school ngayon, I think in mga high school pataas, they include the sex education. Kasi before, there is a sex education, pero ang sex education is just part of the mga reproductive system, the female and the male. But it's not included kasi dati parang I think pag pinag-uusapan kasi yan, nagkakaroon ng mali siya. Pero in fact, dapat hindi. Kasi if you are teaching the bata the wrong way, the students the wrong way, gagayahin nila yan. And this will lead, di ba ngayon, ang daming cases ng teenage pregnancy. In our hospitals, ang mga nabubuntis nasa 17, 18, 19. Sabi ko, Diyos ko. And even in public hospitals, in government hospitals, nakikita namin when I have my exposure in ORDR, ang nanganganak 18, 17, 16, 15. Sabi ko, dapat iha, nag-aaral ka pa. You are not supposed to be here. Kasi this is a responsibility. Yun yung nangyayari. Kasi ang magulang dapat kasi binibigyan ng emphasis yung mga ganyang bagay. Kailangan natin turuan ng tama yung bata regarding sex education. Kasi ang mangyayari, pag tinuruan mo ng mali, mali yung magagawa nila, mali yung nasusunod nila. So, teenage pregnancy, it's very, na talaga siya, very common na siya. Yung mga 17, 18 na nabubuntis. And hindi pa natatapos yan sa pag-aaral. So, nagiging curious kasi sila. And they don't even understand the consequences. Diba? Hindi nila alam ang resulta ng kanilang actions. Okay lang yan pag nabuntis, what if na-infect ka ng HIV? Paano na? Diba? Sobra kang impulsive, sobrang aggressive ka. You want to try everything kasi bata ka. Yun yung nangyayari. So it's really important na mag-guide ng magulang and also in schools, properly teach sex education. And then take PrEP, yung sinasabi ko kanina, mayroon tayong pre-exposure prophylaxis. It's medicine to people, risk for HIV, take to prevent HIV. So meron tayong mga antiretroviral treatments na ganyan. May binibigay sila. Kunyari, here in government hospital, in the facility na nag-check ng HIV, kunyari, if they find out na you're positive, syempre, confidential naman yan, they will give you a counseling and treatment. Yung mga gamot ho, libre. Libre yung mga gamot, tsaka nakikita namin ang lalaki ng gamot. And you don't have to miss the medication. Kasi pag religiously you're taking the medication, it will make you better naman. Diba? Parang wala lang. Pero kailangan mo na talagang i-take yung medication mo for life. So, never share needles, syringes, or other drug injection equipment. Diba? Disposable naman yan lahat. So, one use lang yan. Tapon agad. And of course, no sex peace. If as much as possible, we try to, kung hindi man natin sila mapigilan na gawin yung mga bagay na ganito. Kasi hindi naman 24/7 kasama ang magulang or hindi naman tayo, ordinary, yung mga multiple partners, hindi naman natin sila pwedeng pigilan or hindi naman natin sila nakikita every time. But we need to also give emphasis talaga. No sex peace and also yung stick to one partner. Yun talaga hindi ko nakakalimutan when I was taking my review on nursing for the board exam. Talaga sinabi nila na one partner policy lang talaga. So you can prevent HIV. Okay. So it's also protecting your family, your children, your partner. Diba? Respeto na rin po yan. So sa mga bata rin po, you can, sa mga bata, more na maging tayo sa kanila to guide them properly on sex or when to practice sex. So these are the HIV testing for screening and diagnosis. Yung sinasabi ko kanina, yung nucleic acid test, which is very expensive and it's not routinely done here, provided na i-ask lang ng doctor. So 10 to 33 days ang after exposure niyan, makikita niya na yung infection, acute infection actually. And then yung antigen antibody test mo, yung HIV antibodies mo, even wala pang antibody test na nade-develop, ang antigen present na yan. So much longer siya. It's 18 to 45 days after an exposure. And then meron tayong antibody na lang talaga na yung blood talaga ng HIV, yung dinidetect niya, excuse me. But it's longer pa. So it's 23 to 90 days. But again, if mga tao, if nag-negative kayo with this antigen antibody, kung wala kayo nag-take ng nucleic acid, it's okay. Pag nag-negative kayo an antigen antibody, in a window period or after exposure in a window period, after the window period, check again para confirmatory na negative talaga. Okay? Wag po natin kalimutan yan. Everyone, if you are negative, it's okay. Pero mas okay na i-confirm mo siya after the window period and after the exposure. Mga ilang days. Mga ilang days. Kasi sa testing center naman, they will advise you to do that. Oo. Ina-advise kasi we have the exposure doon sa treatment facilities and they advise everyone to yung mga nag-negative, if they want to take, kasi libre naman, hindi naman, wala naman siyang bayad. At least for ano talaga siya, for peace of mind. At least may confirmatory tayo. So, eto ho, yung sinasabi ko sa inyo, yung CD4 count. So, white blood cell siya that fights the infection. Yung normal CD4 count ng tao talaga is from 500 to 1,400 cells per cubic millimeter of blood. Pero kung meron kang HIV and you're taking medication, nasa 500 lang siya. And it's okay. Kasi you're taking the medication na eh. The medication na itself, yun na yung napapababa ng CD4 count. But healthcare provider will check your CD4 count every 3 to 6 months. So, doon na yun sa facility na nagdadone ng HIV treatment. So, ito po yung sinasabi kong viral load test sa katawan. So, if you have higher viral load sa katawan, it means to say na left untreated yung HIV sa katawan mo or hindi na control. You're not taking your medication. So a low viral load indicates relatively few copies of HIV in the blood. So, ang treatment plan, effective siya. Diba? Kasi ang sabi ko naman sa inyo kanina, hindi ko nawawala ang HIV. Pero you can't control the load of the virus inside your body. So, ang goal mo dyan is to maintain a lower viral blood, a load. Yun lang ho ang target natin. Yun ho ang target ng medication. To interrupt successfully the viral cycle. And then, a high CD4 count and a low or undetectable viral load are desirable. So, the higher the CD4 count, the healthier the immune system. Yun ho sinabi ko kanina. So, the lower the viral load, the likelier it is that HIV therapy is working. So, effective. Effective ho siya. Just take it religiously. Don't miss. Kasi pag miss mo siya, para katulad din siya sa tuberculosis, you will start again. Kasi sa TB, once you miss a dose in a day, you will start again for the next, dapat 6 months yan na treatment. Diba? 3 to 6 months yan na treatment. So, ito, ang TB, 3 to 6 months ang treatment. Ang HIV ho, lifetime treatment na ho yan. So, take religiously, don't miss drug to take. So, next slide, what are the self-test strategies for managing HIV? Paano ba natin, if you are in HIV positive, infected ka na, so, of course, your health, your diet, you need to maintain your diet, although you're taking the medications na, but also you have to take a healthy, wide variety of fruits, vegetables, lean meat, fish, minimize your intake of sugar and salt. Kasi ho, di ba, sugar, mas prone tayo. Pag more on sugar ka, mas prone tayo sa sakit. Sweets, and also salt, and then at least you can get an exercise daily. It's important that we take a 30 minutes exercise every day. Kahit simpleng walking lang yan to. As long as the doctor um, said okay. So sleep and rest also because we're taking a medication na. So you need to have an adequate sleep and rest. Bawal na muna yung mga nightlife, or at least lessen muna. And spend time and family. And in the graduate school, we have this subject about counseling. So this one. And last week, we talked about this. Kasi yun nga ho ang stigma ng Pilipino, pag may HIV ka, nakakadiri, nakakahiya, nakakahawa, hindi mo nalalapitan, alam mo, yun. And you know what? For those people na infected na ng HIV, it's mahirap na nga yung sitwasyon nila. I don't think they need also to be reminded of what they did na. Ang kailangan ho nila pang unawa, family support. At least hindi na ho sila yung kutyain pa. Kasi what do you call this? Parang sobra naman na parang they need also to recover. Diba? And check up. You go to the health, sa testing facilities also kasi doon din naman kukunin yung gamot. So they are providing you the medications, and if you're suffering from depression or anxiety, you seek medical help, therapist. You need someone to talk to. Also, kailangan din, if you have this kind of it's not about the person alone lang ang isi-therapy or ika-counsel. Also the family. Kailangan family ito. It's a family therapy, family counseling, para sila mismo, they will understand ano ang dapat nilang gawin. And then religiously take your medications. Please, to help you live longer, and I think to protect also your family and your partner. So this is very, lang naman to this is very easy to follow if you have HIV na. But it's mas importante pa rin yung wala ka pang HIV is na magiging aware ka na sa actions mo. I mean, it's not necessarily na alam mo kung paano yung treatment. Mas importante pa rin yung wala ka at alam mo sa sarili mo kung paano ito i-avoid. Diba? Hindi naman siya mahirap. Siguro may times na nakakalimutan natin and we try to neglect na may HIV pala talaga, may AIDS pala talaga. So, kaya nga it's good that every now and then, meron tayong mga ganitong usapin just to remind everybody. Hindi naman kailangan na very, very deeper talaga yung understanding about HIV. Basic lang ang kailangan ng tao. Just to understand kung ano ba talaga ito and how to avoid it and what are the things to do kung meron ka na nga nito. Diba? Kasi ang isip nila, hindi na natin. Freddie Mercury, namatay siya kasi nag-late stage na siya. Ang reason niya kasi noon, Freddie Mercury, hindi kilala nyo, i-search na lang sa Google. Very yung mga songs niya, very common, very sikat. Ang sabi niya kasi doon is that hindi niya publicize yung sakit niya. AIDS na nalaman, it's terminal stage na. It's because he wants to protect the people around him. Yung na-expose sa kanya, yung mga partners niya. He's married before. Mahal na mahal niyang wife niya. And then later on, yun talaga. Nagkaroon talaga siya ng contacts with other men. So, nagkaroon siya ng HIV. So, hindi na ho siya yung sasabihin mo na mamamatay ka or magiging intense ang sakit mo. It's just that meron ho tayong treatment and you just need to seek the right medical facilities or right medical treatment for that. Kailangan mo lang talagang lumapit sa mas nakakaalam so that they can help you or yung mga friends nyo or yung kakilala nyo. Kasi hindi ho nakamamatay yung HIV. Hindi ho nakamamatay. Meron hong solusyon. Kailangan lang nating agapan. And you just need to be aware of our activities. Yun lang po talaga. And ang pagiging sexually active natin po. Tao tayo, kailangan natin yan. I understand. Pero kailangan din natin mag-ingat and kailangan natin maging one partner policy. Yan po. So, I think that's the end of my discussion. So, thank you for listening. I hope meron kayong natutunan. So, salamat po sa pakikinig.
Actually, it's very detailed kasi nga legit yung mga experiences mo, Tessa. And we are really happy na ikaw yung napili namin na speaker for today. And actually, hindi pa nagtatapos. We have a second episode for this HIV awareness for next week. Now, if you don't have any questions, you may contact our nurses naman through 420, or you can send a Skype message to APOSI Clinic team. And stay tuned until the next season, guys. And thank you for your time. And thank you also, Tessa. Bye.